Hi, I'm Spike Dolomite Ward, talking to you from Reseda, California. This is the first interview of Moms on the Couch, inspired by Nuns on the Bus. Sister Simone and the nuns taking off, hitting the road, talking to people across America about what's really in the Paul Ryan budget, and emphasizing how immoral it was and anti-Catholic. Love what they're doing, and I would love to do my part in helping President Obama get reelected. And I was thinking, what can I do with limited resources and not very much time, and still kind of dealing with having to go through a lot of leftover treatment for my breast cancer. And I came up with this idea of Moms on the Couch. So I will be interviewing moms with healthcare concerns and horror stories who want to get their message out, but we just don't have the time. We can't just get on a bus and go tell everybody about our story. So we're going to just tell them from our couch and put it up on YouTube, and YouTube will be our bus. So the first interview is going to be me. I'll kick it off, and the next interview is going to be my friend Michelle Massey, who's got a special needs son, and she's up a lot in the middle of the night, very, very concerned about what will happen if Mitt Romney is elected and makes good on his promise to repeal Obamacare and then just trashes Medicare. So you'll hear from her very soon, but in the meantime, I am going to just briefly tell my story. You can get the whole story on my blog at www.highdeductibles.blogspot.com, and then click on how I got myself into this mess, and that'll give you the whole background. But just in short, I found out that I had stage 3 breast cancer in November of 2011. And at that time, my family and I had been gambling with being uninsured, because we just couldn't afford the $1,500 a month premiums that we were buying on the individual health insurance market. Both my husband and I are self-employed, and we were using our home equity line to keep up with our monthly premium payments, and because the recession was making it hard for people to pay us for the work that we were doing, we were having to use home equity to just keep going with the health insurance payments. And what ended up happening was the bank ended up cutting us off from our own home equity line, so that we were forced to have to gamble with going without health insurance. And we thought for sure it would be, as soon as we got ourselves back on track and people could start paying us again after the recession, things got better, that we would be able to afford our health insurance premiums. And then I found out I had cancer. So it was the worst and best day of my life, in that you get the news that you have cancer. Nothing can be scarier than that. It was awful. It felt like the earth had just opened up and swallowed me whole. And I was in such shock I could barely think. And a good friend of mine, who is a fellow nonprofit leader in Los Angeles, Becky Constantino of Access Books, a real good friend, she just went into high gear and started searching on the internet, looking for solutions for people like me, middle class, middle age, without the cash and uninsured. What do you do if you find yourself in my situation with cancer? And she came across PCIP, which is the pre-existing condition insurance plan that had already passed through the Affordable Care Act in 2000. It was already enforced in 2011, and I had never heard of it, and nobody had heard of it. And it just seemed too good to be true. So she had done the research for me and talked to the people herself in California, the health insurance company that runs it here, and then encouraged me to call, which I did. And it was, I had a hard time believing that it was, that there just wasn't some sort of catch. We've been with so many other insurance companies. There's always problems. There's always some sort of way that they can stick it to you. So that's where my head was at, thinking they're going to stick it to us. And what ended up happening was they were very compassionate, and they were really kind to me, and they wanted to see me get insured. And what I had to do was present proof of citizenship, a letter from a doctor with their license number saying that I had this pre-existing condition and that I had to be uninsured for 6 months. So I met all those qualifications, sent in a check for the premium, all based on age, has nothing to do with your health care status. And then within less than 2 weeks, I was insured and receiving treatment for my cancer. And what I want people to understand is that this is not socialized medicine. This is not government-run health care. I have the best of doctors in the West San Fernando Valley where I live in Los Angeles. I'm receiving the best of care. I have a wonderful oncologist. I had a great surgeon who did my double mastectomy, and now I'm undergoing reconstruction, treatment for reconstruction with an outstanding plastic surgeon with an incredible reputation. So I pay premiums, deductibles, and co-pays, and my life is literally being saved by the Affordable Care Act. What I want people to know, besides the fact that this is available to people, if you have a pre-existing condition, please look into it in your state. And when I came out and told my story in December, outing myself in an op-ed in the LA Times, I wanted people to know about PCIP. It would help me to help other people, because I was just so I was so depressed about my situation, and I thought if I could just get the word out about PCIP, I'd feel better. And I did. I got the word out. A lot of people got help, but I also got a lot of flack for that. Most people that read my piece, which went national that day, the Atlantic Wire had picked it up, and then the next day it had gone international in different languages, which I was completely unprepared for. And like I said, it was mostly positive, the feedback that I got, but I got some hate mail that really scared me. And it really opened my eyes to the dark side of our culture. And being on the receiving end of blind hatred from people that really don't care about other people and don't see it as their responsibility at all to have to care about other people, whatever their reasons are. It was embarrassing to me as an American that we have Americans that think like this and will go out of their way to wish a total stranger harm. You know, some people just said that they didn't want to pay for my health care and that they wished I would just die. I was accused of being irresponsible, being a deadbeat. My husband and I were opportunists, and it couldn't be further from the truth. And my hope with writing that op-ed was also to help middle-class people, you know, see that the picture of the uninsured is, this is it. It's middle-class America. And what's happening is, if you aren't poor enough to qualify for Medicaid right now, which we weren't because our tax returns said we made too much money because my husband had cashed in his IRA for us to be able to make it through this recession, that counted against us. So I couldn't qualify for any of the programs that you can get because you have to go and apply for Medicaid first, and we wouldn't have qualified for that. So what middle-class people, the danger middle-class people are in right now is that you won't qualify for Medicaid, and you will have to, you know, exhaust all your retirement, whatever resources you have, and if you don't have that, you're out of luck. So if you don't own your own home and you have equity that you can access, or retirement, or savings, or other assets that you can liquidate, you're in big trouble. So I wanted people to know that, and like I said, a lot of people wrote me and said, thank you for doing that, keep speaking out, which I have been doing. And then, of course, there was the fringe groups that really go out of their way to make their opinions heard.